Tonight, coronavirus presenting a difficult decision for colleges across the United States, and that is whether to reopen campuses in the fall to allow students to go about such a crucial time of their lives as scheduled. But one university president, who's also a doctor, says he's, quote, cautiously optimistic that his 46,000 students can safely return to school and those in dorms to dorms in August. Out front now, Dr. Robbins, president of the University of Arizona, also a cardiac surgeon. And Dr. Robbins, I really appreciate your time. So you come to this as both an academic and a medical professional. As a medical professional, you know the risks. You know the risks everyone talks about reopening a college campus with nearly 46,000 students for the fall. So what makes you optimistic? Do you believe fundamentally you'll be open in the traditional sense of people being on campus?
I do, Erin. Thanks for inviting me onto your program. I think that it'll be a combination of face-to-face classes and continuing what we're doing today, which is a remote distance learning online mode. I think we're going to have to offer both, but we're excited about having our students come back to campus.
And look, I'm sure there are a lot of them who are thrilled about that. I mean, I'm sure some are nervous, but many I know want to continue with their education in the traditional sense. So Dr. Robbins, Harvard announced yesterday that it will open in the fall. That was the headline. But then the real headline to me was not that. It was the warning from the provost, which was, quote, we will need to prepare for a scenario in which much or all learning will be conducted remotely. What do you say to those institutions that are explicitly, saying most or all of their learning could just be online in the fall?
Well, we think we can safely get people back to campus. As you know, when this all started back in mid-March, we began immediately to develop our own testing kits, swabs for the RT-PCR test for the viral load. And then in parallel, we began developing this ELISA antibody test that we're going to offer to all 60,000 of our university community, all of our faculty, staff, and students.
Wow, so you'll be able to test everybody?
Yes.
That, which is, I don't know anyone else anywhere who has that sort of optimism that you've been able to do that. So with what frequency, and does this allow people then in your theory, Dr. Robbins, to be back in dorms actually?
Yes, we think so. Obviously, we're going to have to use all of the precautions for mitigating this virus until, as everyone has been talking about, we get the ultimate herd immunity, which is a vaccine, which is still at least a year away. But we think frequent testing, tracing, and then to isolate our students will help us to safely navigate through this. The Governor Ducey of the state of Arizona found out that we were doing this and developing this all in-house at the University of Arizona, and asked if we would be willing to scale up and test all frontline healthcare providers and first responders in the state of Arizona. So we begin that testing tomorrow.
And so on this crucial question, do you have everything you need because you developed it in-house? I mean, whether it be reagent or you've got everything to actually conduct and read the test?
Yes, we think we have everything we need. We're working on supply chains, but we feel confident that for our student population, our faculty and staff will be all set for that. And then the healthcare providers, we're planning to get that done in the next month or so. I would like, of course, to see it expand to test all 7.3 million residents of the state of Arizona. So we're working with public entities, with philanthropic dollars, and with our private partners to try to raise the money to be able to accomplish this.
Well, Dr. Robbins, thank you very much. I hope you do accomplish that. And, I hope if you're able to reopen, you go ahead with these plans if you can, because I know for a lot of kids that will make a big difference. Thank you, sir.
Okay. Thank you, Erin.